You may have heard of hepatitis A, B, C, or even D. But have you heard of hepatitis E? Well, it's the most recently discovered of the viruses that causes hepatitis. The World Health Organization estimates that 20 million people are infected with this virus yearly. And in 2015 alone, this virus caused approximately 44,000 deaths. Let's find out more about this virus. Hi and welcome to my channel. If you are joining me for the first time, my name is Louisa. Today, Dr. Ado is going to join me and he's going to talk about the hepatitis E virus. But before then, let me tell you what hepatitis is. Hepatitis is an inflammation of the liver, and several conditions are known to cause this. For example, some health conditions, alcohol consumption, and some medication are known to cause hepatitis. However, viral infections are known to be the common cause of hepatitis. So now let me turn over to Dr. Ado for more insights.
Thank you, Dr. Louisa Sawyer, for having me. Hepatitis E virus, hereafter referred to as HEV, is the most recently discovered of the viruses which attack the liver. It is called hepatitis E because it is enterically transmitted. The way of getting hepatitis E is that it is shared through the feces of infected people. The main transmission route implicated in most outbreaks is the consumption of fecally contaminated water, even though other routes exist. For instance, infected pregnant women can transmit the virus to their fetus. Blood transfusion also carries a higher risk. Person-to-person transmission of hepatitis E is not common, but was reported in a large outbreak in Uganda. Now, association with pigs and their environment is considered a very important risk factor for the zoonotic transmission of hepatitis E virus, and so individuals in occupational exposure to pigs have been known to carry higher serological evidence of infections to hepatitis E virus. Hepatitis E virus among pigs is apathogenic, and transmission in pigs occurs either through direct contact or through consumption of feed or water contaminated with infected feces. But why should we know about hepatitis E virus infections? About 20 million infections of HEV occur annually, with 70,000 deaths resulting from acute liver failure. And hepatitis E virus in pregnancy is mostly fulminant, that's very severe. And about a third of the world's population, mostly about 3 billion people, are at risk of hepatitis E. Hepatitis E virus shows two epidemiological profiles. The first one occurs in developing countries where the disease is waterborne here. This occurs as a result of people living in squalid living conditions without access to improved sanitation and water facilities. The second epidemiological profile occurs in industrialized or developed countries, which is due to the zoonotic nature of hepatitis E virus. Here, initially was thought to have occurred from people with recent travel from endemic countries, but recent evidence suggests that hepatitis E virus in industrialized or developed countries might have resulted from autochthonous cases, mostly related to the consumption of pork or pork products. So animals such as domestic pigs and wild boars are known as major reservoirs for hepatitis E virus infection. But who should be tested for hepatitis E virus? Anybody who shows signs or symptoms of viral hepatitis but tests negative for hepatitis A, B, or C should be immediately considered for hepatitis E virus. Any other person who is showing symptoms or is symptomatic with a recent travel history from endemic countries should also immediately be considered for treatment or for testing for hepatitis E virus. How should we prevent hepatitis E virus? First of all, because in most endemic countries, It is basically due to the fecal-oral route. Access to improved water and sanitation facilities should be made a priority. In countries with sporadic hepatitis E virus, consumers of pork or pork products must be made aware of the dangers of consuming pork that could be contaminated with hepatitis E. This means that good pig management practices are key for the controlling of hepatitis E virus. The situation with hepatitis E virus infections in Ghana is that the healthcare system does not screen for hepatitis E, only B and C. This could lead to many cases of hepatitis E going undetected or undiagnosed. Hepatitis E virus is very high among pig handlers in Ghana. Two reasons were given for this. Number one is that in many communities, animals, in this case pigs, share living space with humans. This could lead to the possible zoonotic transmission of hepatitis E virus from the animals to the humans. The second reason given is that access to water of good quality is missing in most aspects in Ghana. Even though no outbreaks of hepatitis E virus infections have been recorded in Ghana, all the major risk factors for hepatitis E virus are available. There has therefore been a clarion call to include screening of pregnant women seeking antenatal care for hepatitis E virus, owing to the fact that hepatitis E virus in pregnancy is fulminant. And also in Ghana, most of these pork retailers are women, and also the worsening water and sanitation crisis we have in Ghana. Also, further studies are needed on the particular strains or genotypes of hepatitis E virus circulating in pigs and humans. This is very important as it will help in control or prevention measures.